At the end of November, Stockport CCG launched its Know It, Check It, Treat It campaign to raise awareness of the symptoms of COPD, that's Chronic Obstructive Pulmonary Disease. The campaign began with a drop-in clinic at the Wellbeing Centre so people could check the health of their lungs.
Well, COPD is a long-term condition of the lungs, which used to be divided into chronic bronchitis and emphysema, and now it's like an umbrella term that covers those two and a few other conditions. And today is an event increasing public awareness about COPD. But basically, if you go back a step from that, what we want to do is to encourage knowledge about lung health. So we want a message of what are healthy lungs look like, how do they feel, and what is it like to have not so healthy lungs, and what can we do about it. So the first part, know it, recognise what symptoms like cough, breathlessness, coughing up sputum, getting regular chest infections, and when you say breathlessness, what you mean is, for example, is a flight of stairs a real problem? If you're out with your friends the same age as you, do they have to slow down for you? And then also, do you get uncomfortably breathless doing normal things around the house or in the garden or out when you're shopping? So that's the first part, know it. And how do you know whether that represents a lung disease or not? Then the second part of that is check it. So here today we're doing free lung health checks by doing a little breathing test into a little machine. It'll tell you whether you're okay or whether you might have a problem. It's a screening test, so it's not the gold standard accurate test, but it does give you an indication of whether maybe you ought to take this a bit more seriously and go to your GP and get a proper, more detailed test. And then the third part of that is treating, so that when you have found out that you might have a problem, what do you do about it? How can you prevent that from getting any worse in the future? What are measures that you can take, and what are measures that your doctor and nurse can give you to take as well? It's important to find out as early as possible, because the earlier you diagnose any condition, the more you can do about it, and COPD is no exception in this. Unfortunately, about 10% of patients who have COPD only find out when they're admitted to hospital with a bad chest infection. So that's too far down the line for my comfort, and I would like to find out before that when I could do more about it. So if I find out that I've got mild COPD at an early stage at a young age, then I can do things like look after myself a bit better, lose a bit of weight if I need to, eat better, exercise regularly, keep myself as fit as I can, and most importantly of all, if I'm a smoker, stop smoking. Stopping smoking is the most important treatment for COPD, and it's vital that you do this with all the help that's available. Help is available for free on the NHS, and your chances of quitting with the right help and the right treatment are actually increased by a factor of 10. So you're 10 times more likely to give up with the right kind of help than just trying to do it on your own. Okay, so if you are that person, are you 35 years old or older? Are you a smoker or an ex-smoker? Are you more breathless than your friends of the same age? Do they have to slow down for you when you're walking together? Do you have a regular cough? Do you always get that chest infection when the winter comes along? If you are that person, then you ought to get a check. Most GP surgeries now will be able to ask you the right questions and perform the right breathing test to see if you've got it. If you find out what you've got, look at everything in a positive way. Yeah? So I have good lung health. My lung health is not as good as it might be, so I might have a problem, but I know what to do with it. Or I know I have a problem, but this is how I can treat it, and these are the measures that I can take to help myself, along with my doctor and my nurse, to make me as good as I can in the future, to get my lungs as fit as they can be, and to get the rest of me fit as well.